About long COVID. Although most people with COVID-19 will get better after a few weeks, some people do not fully recover from their illness. Post-COVID conditions are health problems that people experience 4 or more weeks after being infected with the virus that causes COVID-19. Symptoms can be new, returning, or ongoing. They can last for months or longer and range from mild to extremely debilitating. Post-COVID conditions are also called long COVID, long haul COVID, chronic COVID, post-acute COVID, or post-acute sequelae of COVID-19, PASC. While there are many differences and overlaps between conditions, many people simply refer to these ongoing health problems as long COVID. Some people with long COVID may face challenges returning to work, school, and other activities that allow them to thrive. As of July 2021, long COVID and post-COVID conditions can be considered a disability underneath the Americans with Disabilities Act, or ADA. Here's what we know about long COVID. There is still a lot to learn about COVID-19 and long COVID. MDH and the Centers for Disease Control and Prevention, the CDC, and researchers from around the world are working to understand the short and long-term effects of COVID-19. Also trying to know who is at most at risk for developing long COVID, how to prevent it, diagnose it, treat it, and track post-COVID conditions. Who can get long COVID? Anyone who has been infected with the virus that causes COVID-19 can develop long COVID, including children. While some post-COVID conditions are more common in people who experience severe illnesses or hospitalization due to COVID-19, long COVID can also happen to people whose initial infection was mild or asymptomatic. We are still learning how common long COVID is, but studies show that 10 to 30% or more of people who have COVID could have symptoms for months or longer after their initial infection. Children and young adults may also be more susceptible to a very rare but serious post-COVID condition called multisystem inflammatory syndrome in children, or MIS-C. Here are some symptoms. Long COVID can affect many different systems of the body. Sometimes systems get worse after physical or mental activities. People with long COVID report experiencing different severities and combinations of the following: difficulty breathing or shortness of breath, tiredness or fatigue, difficulty thinking, concentrating, or remembering, which is sometimes called brain fog, cough, chest pain, stomach pain, headache, fast beating or pounding heart, also known as heart palpitations, joint or muscle pain, a feeling of pins and needles, diarrhea, sleep problems, fever, dizziness or lightheadedness upon standing, skin issues like a rash or hair loss, mood changes including depression and anxiety, changes in smell or taste, and changes in menstrual period cycles. How to diagnose and treat. There is no single test that can diagnose long COVID itself. but doctors may order a variety of tests to better understand symptoms or to rule out other possible causes. They may also ask about a patient's history of COVID-19 infection and other underlying medical conditions. Currently, there is no cure for long COVID, but healthcare providers may be able to help reduce or manage symptoms through rehabilitation services, medications, and coordinated care. Treatment may include specialists that focus on the heart, lungs, digestion, diet, nutrition, mental health, neurology, physical therapy, or other fields of medicine. Some people with long COVID receive a diagnosis of myalgic or chronic fatigue syndrome. Also known as ME/CFS, or POTS, postural orthostatic tachycardia syndrome, and other health situations. Medical specialists may be able to apply the same treatments and therapies for known conditions to help people with long COVID. Some people with their long COVID symptoms improve over time. We are not yet sure if long COVID symptoms could be permanent or irreversible in some individuals. Prevention. The best way to prevent long COVID and post-COVID conditions is to avoid getting infected with the virus that causes COVID-19. The more steps you take to protect yourself, the safer you will be. As always, vaccination is the best way to reduce your chances of infection. Because no single step on its own is perfect at preventing COVID-19, the safest thing to do is layer prevention measures when you can. The impact for communities. While we are still learning about who may be more likely to develop long COVID, we know that COVID-19 pandemic has not had an equal impact on all of our Minnesota communities. As a result, some communities such as Minnesotans of color, American Indians, people with disabilities or who live in rural areas, LGBT community, or others who experience homelessness or have unstable housing may be more likely to experience long COVID.